Hey, my name is Dr. Bassi. I've done a lot of therapy before in the past, and I would say my approach when I first started is not the same as it is now. It's come a long way. I want to give you 4 steps that can help you improve your own therapy skills. Everyone knows the typical ones like be empathic, be nice, listen, but I want to give you more than that though. And these steps are coming from how I've improved my own therapy skills. So here they are. Number 1, get focused. Even if you think you're good at multitasking, you're probably not as good as you think you are. They probably notice when you're doing other things, and you're not going to be as thoughtful and reflective as you'd like to be based on what they're saying. And maybe your memory is going to be a little bit affected. You're not going to be able to remember certain things from the past, things that they've done before in the past that would make you a really awesome person at giving some really good feedback because you remember those details about what they said in the past. Number 2, understand their fears and concerns. These are probably driving a lot of their impressions of medications, impressions of you, impressions of therapy. They're affecting everything that they're feeling. So, and they're probably something that they don't want to share with you right away. So you're probably going to have to get them to trust you, first of all, and then understand gently what their fears and concerns are. Maybe they feel like they're really irrational, maybe they feel a little embarrassed by those fears, but they're having such a huge impact on how they're feeling. You need to address them. Number 3, and this one was a big one for me when I was first starting off. So in our mind, when we're doing therapy, we have kind of our own agenda. We're constantly thinking about what they were saying and trying to remember that. But that can be easy to really not listen and start to just move on to the next topic that you think is important. As a result, there are these comments that seem like they're just throwaway comments. The person's going to mention, I feel like a burden. I can't go over my parents' house. And then you think it's maybe not even related to what they're talking about. So you go and talk about the next topic that's on your mind. But try to maybe go into more depth, inquire, poke around a little bit, talk about those throwaway comments, get more clarity, ask them why, ask them where it's coming from. Because often there's a lot more meaning than you think in those throwaway comments. And just moving on, you're going to miss out on a lot of really important issues that are going on there. Lastly, and I know this is easier said than done, but you need to check your emotions at the door before you go into the therapy session. Our patients can say a lot of things that we maybe don't agree with politically, etc., but we need to keep that at the door so the patient has a blank slate for themselves to understand themselves. Oftentimes people try to elicit a lot of very negative emotions from you to try to get you to feel what they're feeling. It's important for you to remain impartial and not get caught up in these negative emotions. While you're speaking to patient, ask yourself why you're feeling that way. And if you have your own emotions that are going on inside, most likely that person feels that too. And it's probably not the most appropriate for that therapeutic environment. So you need to understand where those are coming from because your own experiences can weigh in on how you're reacting to the patient and affect what you say and what you do and how you engage with them too. And ultimately, you want to be as supportive as possible, unconditionally supportive to that patient as possible. And if you're coming into it with some bias, then it's going to affect how you react to that person. So you want to be as unbiased as possible and as supportive as possible towards that patient. And that means not having any sort of negative emotions or feelings that could potentially come out in an uncontrolled manner with that person. Hopefully these 4 tips are really helpful for becoming an awesome therapist.